We see a lot of patients who come to us from very far away places, both in India and outside India. And they have a very common concern. So after the knee replacement procedure, how frequently they need to visit us to ensure that everything is good. And we'll discuss this answer in detail today. So first thing that we need to understand that we discharge the patient after 5 to 6 days of the knee replacement procedure itself. And we do this to ensure that when they reach home or the hotel, they are in a very comfortable medical and physical state so that they do not need any kind of extra care and they can look after themselves. We do normally ask our patients to come back to us after 10 days of the surgery so that we have a look at the overall well-being of the patient, teach them the exercises again, guide them about any medicines if they need about it, and any kind of instructions that may be helpful for them. Normally, on the 15th day after the procedure, we remove the dressing and now the patient is allowed to live as they wish to. They do not need to follow any specific instructions. They do not need to take any extra medicines. They just need to do the exercises that have been told to them and continue living happily. However, to ensure that they are in a good health, we do consult them on 30th day after the procedure. And this consultation is normally done via the video consultation group. Most of the patients can fly back to their native location between 15th to 20th day after the procedure. On the 30th day, when we do the video consultation, we again check whether the patients are walking well, are doing exercises as they were told, and taking all the necessary instructions diligently or not. After 1 month of the procedure, 98% of the patients will not need any follow-up. However, to maintain a continuity of care, to maintain a precautionary check, we request our patients to come back to us on the video consultation itself on the 3rd month after the surgery. Because 99.99% recovery has been finished within 90 days of the procedure. So by the 3rd month, when we see the patient again, in fact, 10 to 20% of the patients meet us on the 3rd month. 80 to 90% have gone back to their normal life, so they don't normally come back on the video call to visit us. So by the 3rd month, 100% of the patients do not need any kind of follow-up, any kind of care anymore. But yes, it's a good habit that you get the x-rays of your knee done every 2 years after the knee replacement surgery to ensure that the knee joints are working well, they are in good alignments, there is not something like loosening or something which can cause later on troubles, although it's very rare that a knee replacement patient who has followed the instructions, who is living life healthily, will face any such problems. So simply speaking, 3 follow-ups are more than enough after a knee replacement procedure. The first one is 10 days after the procedure, second one 15 days after the procedure, and the third one 30 days after the procedure, and the third one is majorly done over a video consultation.